Colostrum is the first milk that your body makes. It starts being produced during pregnancy and it is readily available for your infant right after delivery. Frequent breast stimulation and adequate milk removal is necessary to create a full breast milk supply. Your colostrum will transition to mature milk usually about 3 to 5 days after delivery, and during that time your breasts will start to feel fuller and heavier.
Often babies latch very well right after birth, and then they become very sleepy when they reach the postpartum floor. This is very normal. Holding your baby skin to skin promotes babies' natural feeding responses and helps them to want to eat more. Skin to skin also helps to calm and relax babies, helps to regulate their breathing and their heart rate, and also helps to regulate their blood glucose levels. Early infant feeding cues include lip smacking, rooting, tongue movement, and hand-to-mouth activity. Crying is a late sign of hunger. We expect 1 to 2 good latches in the first 24 hours. If your baby does not latch during this time, you can hand express your colostrum and provide this colostrum to your baby.
First, you're gonna make a C shape with your hand, and you're gonna press back against the chest wall, compress, and release. Back, compress, and release.
During the second 24 hours, you might realize that your baby wants to feed a lot more frequently. This is typically referred to as cluster feeding, which is a normal part of lactation and an expected newborn behavior. Cluster feeding provides the breast with frequent stimulation, which is needed to promote a full milk supply. Frequent removal of colostrum helps to tell the body to transition to mature breast milk and gives your baby all that nutrition that they need. During this time, it's important to keep your baby skin to skin as much as possible and continue to practice that responsive cue-based feeding. Keeping your baby close to you and doing frequent skin to skin helps remind your baby of what life was like inside the womb. It reminds them of that warm, cozy environment that they're used to. During cluster feeding, parents will often ask about introducing a pacifier. And while there are benefits of introducing a pacifier, such as they may help to reduce the risk of SIDS, the American Academy of Pediatrics recommends waiting about 2 to 4 weeks until breastfeeding is well established. Your milk supply is in, the baby is gaining weight appropriately, and your engorgement has been relieved. Early introduction of a pacifier may affect your baby's latch, may hide early hunger signs, and may lead to missed feedings. Missing feedings, especially in the first couple of weeks, may affect your baby's growth and weight and may also decrease your milk supply.
Now we're going to talk about how to latch your baby to the breast. This seems pretty challenging at first, but you and your baby will find the right position that works for you. You will learn the different positions in the hospital, cross cradle, when the baby's across you, football hold, there's a laid back position, or side lying. The main thing to know is you want your baby to be tummy to tummy with you, and you want their head, shoulder, hips in a straight line. We like the asymmetric latch, where you're putting baby's upper lip towards your nipple and their head is going to be tilted. And you want their bottom lip at the lower edge of the areola. The first couple of weeks they need a little help, which is normal. We want the latch to be comfortable and for you to feel pulling and tugging, no pinching. And when babies are sucking well at the breast, they have a long drawing suck, not a short chompy suck. And we like the angle of the mouth open, about 140 degrees.
During your hospital stay, you will be visited by one of our international board-certified lactation consultants. We will round on every patient to assess needs and provide basic lactation education. We provide full consultations when indicated for patients needing additional assistance. After discharge from the hospital, you can contact our lactation team via our breastfeeding helpline. We also offer outpatient appointments at our lactation clinic located within Meriter Hospital.